Hi there. My name is Grace Isong Akpan. I am a member of the Advocacy working group at the PACT. As the coronavirus pandemic has unfurled across the world, the public health crisis has brought with it considerable social and economic aftershocks, which may be felt disproportionately by people living with HIV. The discrimination and marginalization experienced by young people living with HIV places them at heightened risk of experiencing mental health challenges during this time. The pressure of dealing with both the HIV pandemic and COVID-19 pandemic has had a huge impact on the mental health of people living with HIV. Early lockdowns left people living with HIV who were away from their home unable to access their treatment. The link to HIV treatment has been broken. People who are newly diagnosed are often not starting treatment. Since the pandemic, people have had difficulty in accessing treatment and new HIV infections are not being diagnosed. COVID-19 has put many children out of school since education can protect children's health and well-being. Many children, especially girls, are now at risk of contracting HIV. Programs for preventing vertical transmission, voluntary medical male circumcision, PrEP, and other HIV prevention options have been interrupted. COVID-19 stigma has been directed at people living with HIV. Access to justice has been curtailed, and COVID-19 has been used as an excuse to introduce laws to people living with HIV. And this is what I recommend. Advocate for inclusive COVID-19 support services and social protection that are also accessible to young people living with HIV. Advocate for a human rights-based response to COVID-19 that prioritizes already vulnerable populations and reduces non-stigmatizing care and non-punitive measures for anyone with COVID-19 related symptoms or for other reasons such as stigma related to HIV status. Everyone who is eligible, regardless of HIV status, should get vaccinated.